Hey everyone, this is Dr. Zimmerman. Every now and then I get an email that hits my inbox that's a medical report that I think we need to pull up and have a discussion about. And I recently got one on anxiety screening with syncope. So, syncope is basically when people are passing out, right? A lot of these people have near syncope episodes where they may have dizziness, they may feel lightheaded, and other things like that. So I'm going to share my screen and share that article with you. So GAD-7 is generalized anxiety disorder -7. So it's a 7-question questionnaire on anxiety screening. Now, if individuals score above a certain point, they get labeled as likely having mild, moderate, or severe anxiety. Now, what they found was whenever they were doing a GAD-7 screening, that increased the amount of individuals being referred to psychology clinics. Now, this is a really, really big deal when we look at POTS and dysautonomia, because it is known that those with POTS and dysautonomia are more likely to have symptoms such as anxiety, but anxiety can also promote those symptoms. So is it more of the chicken or is it the egg? And this is why I want to have a conversation about this. Because unfortunately, what happens in my experience? Well, once you get the label put on you, anxiety, boom, there's a stamp to your forehead. And so now when these individuals with postural orthostatic tachycardia syndrome, they may have dysautonomia, orthostatic intolerance, right? These are the people going to some of these syncope clinics. That anxiety and mental health label is going to weigh more heavily and it prevents them from being taken seriously. So instead of them really getting the care they need, it's well, you scored high on this. We really need to get you to a mental health clinic. They're going to talk to you about counseling. They're also going to talk to you about the different medications. So this was something that was research done, presented at a conference just very recently. Now, one of the things they said, hey, there's a correlation between anxiety and neurocardiogenic syncope, right? So once again, syncope is the passing out. Others will have near syncope, which is feeling faint. They've got to sit down and have issues with that. Now, what they noticed when they came back and they looked at it, right? They're like, you know what? We're finding a lot, right? 70.6% female and 29.4% male. Now, post screening, it changed a little bit to 62 and 38 is what they're looking at. Now, they were referring initially 14%. After that, they were referring 32%. So over doubled the amount of people they were referring for psychiatric evaluation. And it's as no surprise that females were more dominant in the groups that they were screening. We do know that females have a higher likelihood of any type of dysautonomia, specifically POT, and they're going to end up at the syncope clinics. But the problem is, once again, it just gets blamed on the mental health side. So what they're saying here is like, oh, well, we need to have them get sent to these other clinics. Now, there's a problem with this, as we've discussed. Now they've become the label because psychologists and psychiatrists have their place, but they also have a massive lack of understanding in postural orthostatic tachycardia syndrome and dysautonomia. And they're likely going to treat the symptoms or the effects of postural orthostatic tachycardia syndrome and not the underlying causes. And that's super, super important that we distinguish the two, because these are the people who desperately need help, but they're also going to be very, very, very frustrated because they are sick and tired of being told that every single one of their symptoms is related to anxiety versus anxiety being part of the picture of what they're dealing with. Are there those that had pre-existing anxiety before they developed it? Absolutely. But to gaslight them and to tell them that everything is because of their anxiety is absolutely wrong. And unfortunately, that is something that my patients experience time and time again. They've been put on escitalopram, they've been put on Cymbalta or Wellbutrin, They've been given hydroxyzine and Xanax or clonazepam and other things to say, well, it's because of your anxiety. And guess what? Most of them, while their anxiety may come down a little bit, their fatigue, their brain fog, their dizziness, their headaches, their word finding, their memory doesn't improve as well as they would like it to. And it often doesn't change at all. So while it's okay to screen these individuals for comorbid anxiety, it's also not okay for us to gaslight them and then to overly attribute all of their symptoms to anxiety. So if you're dealing with postural orthostatic tachycardia syndrome or other types of dysautonomia, orthostatic intolerance, right, inappropriate sinus tachycardia and other things like that, what has been your experience with getting help as you've bounced from one provider to the next? Do you feel understood? Do you feel gaslighted? Maybe there's a little bit of in between. And where did you turn to actually find answers and solutions if you've been able to find it? Till next time, this is Dr. Z.